we're going into our action items. The first one is 5.1, approve, reject non-licensed staff's COLA request.
That's the COLA and
Yeah.
the insurance.
And the insurance cap, $25 on the insurance cap and the 3% COLA.
And with the ability to raise that cap?
Well, yeah, that would be brought again.
I would come back to you.
You'd bring that back if it goes to 9.
Yes.
But right now, we're voting on this 3% and the $25 insurance cap.
I'll make the motion.
Thank you. I got a motion.
I'll second.
Got a motion and second. Any more discussions? All in favor?
Aye.
Aye.
Opposed?
So you can just let them know that this is for now, and then once we
Right.
get budget numbers
Yeah.
and insurance renewals, we'll.
There's the potential
We can
for
pay.
an increase. Okay?
On our next one, 5.2, approve of Lake District Nursing Services. We came out of executive session, and then before we brought you back, there was some questions and discussions, and because they don't feel like it's to the point of voting on it, so
Okay.
there was a couple questions we
yeah.
want to
Sure,
bring back
yeah.
to you,
Okay.
so.
So what is on item I on the back, PPDs, are those STDs? Is that what that means? Positive PPDs are on prenatal and family planning programs.
Or is that, yeah, prenatal, or parent?
I'm gonna have to ask Charlie on it.
Program?
but-
Yeah, that's different than, because there was another part, inspecting referral education, including suspected of having communicable diseases. That would be where the other one would come under G.
Right.
So this has got to be part of prenatal or family
What about-
planning.
Yeah. Pregnancy determinations or something.
Yeah, I don't know what that is.
Yeah,
Yeah.
it sounds controversial.
Yeah,
Yeah.
yeah.
It
So-
does.
so-
Like I said, the
Yeah.
politics of it, I think,
So-
aren't gonna be resolved.
Yeah,
That's
what it-
I pulled up on Google, I don't know if that's what it's referring to.
Purified protein derivative? I don't think that's it.
you have
Well,
These
I'm
skin
against
tests.
that.
continuing
whatever it is.
supervision of students who have positive PPDs.
When I first read it,
So what is it?
The method used
Is
to
it-
diagnose.
isn't that
positive protein.
Oh,
derivatives?
Well, it might be, okay,
Is
the
it a
PPD
TBT testing?
skin test is the
Yes.
method used to diagnose
Tuberculosis.
tuberculosis
Oh, yeah.
infection.
That's what it is.
Yeah.
And I
That's
first
the
thought
PPD
that's what it
derivative.
was.
Yep.
Yes.
Good catch.
Well, what
Okay.
does that have to do with
Prenatal and family
positive
planning.
that or on parental and family planning
I don't
programs?
think they're the same, I think.
I think it's
they
just-
put them in the same sentence.
Yeah.
That's weird.
Yeah, because I mean, if you had somebody who had tuberculosis, they would need,
Yeah.
More than family planning.
well,
Well,
Don't get pregnant, whatever.
and that's a communicable disease, but then they're
Yes.
talking about it G up above too, so that's, yeah.
And tuberculosis is, I believe, on the
So,
regs.
so
Is it?
who wanted this? I know it's been talked about for
the
months. It's
superintendent's have, yeah.
Okay, that's
This has
what I
been their-
thought.
This has been their request, yeah.
So that's
We
what I
had talked
told them,
earlier,
I
we had
thought.
talked earlier in the year, about, you know, what other things are you looking at, what other things can we do and stuff like that. Nursing services was brought up and they have all three agreed, that this is something that they definitely want to have happen.
So what
So-
are their thoughts about what the nurse would do?
But saying this, they've seen this, yeah, as far as what, they want somebody who can come into their school and just be there as a resource, be able to talk to kids can ask them, you know, questions that they might not be willing to ask a counselor, or may not be
Yeah.
willing to ask a teacher.
So how
kind of thing.
How do they know, if they're not willing to ask these questions, how do they know there's kids that want to ask these questions?
Because they come in public health all the time.
Yeah.
Well, then that's
Talk to
what
the
public health is
nurses.
for.
Yeah.
Well,
what is it?
Not every kid's willing to
Not
go
every
in there.
kid's
I
gonna
mean,
go up there,
Kids
yeah.
have some
No.
weird thoughts and ideas and stuff, and they need to have a good, solid answer.
Okay, so how
And-
come Charlie isn't? Because public health is under the hospital, right?
Right, right.
So if they're going to public health anyway, why isn't public health just coming to the school once a week? Why aren't they just why do we,
Because that,
why are
Because
we doing this?
there's a cost to that, and
cost
Charlie,
that they don't have.
yeah, they don't have the funds to be able to do that.
And our 14,000 gets them there?
For
That's-
one day a week, yes.
And is that
Pretty-
one day at each school a week? Or
No, one day a week, like, so I could say it's on Mondays. So on Mondays, they will be working in the schools. So this one Monday, they may be in North Lake, one Monday they will be at District 7, you know, and then
Okay,
so.
so each school doesn't get one day.
No. It's
No.
1 day a week for the county.
So isn't
Yeah.
it more feasible that since they have a part-time public health nurse, and she chooses to be part-time, up
Right.
in North Lake, that she would not be the one that goes for a couple of hours to
And
the
they,
school?
I'm not saying it's gonna be the same person.
Yeah,
in
that's why
both
I'm
areas.
asking,
No.
to utilize our money a
Yes.
little better?
Yes.
Okay.
And I think he fully intends to do that.
Okay.
Yeah.
Kind of my question is like Freydale and Plush, is it really feasible to have them come there?
You could, I mean, it may not be near the amount of time.
That's what I'm thinking,
You know.
I'd rather they maybe spend the resources at the bigger schools.
And
where-
I would say that, yes, that's probably, with 9 kids,
And they're not
No,
gonna
they're
talk to
not.
anybody.
yeah, probably not. They probably know more about their health issues just from vaccinating cows and horses and everything else than anybody else, but,
Well, and you can,
It's-
I mean,
but I mean,
there's so
it's-
much individual
but it's,
stuff going on with them there that teaching staff knows.
but it's available, I guess,
Yeah.
you know, we would make it available to them that
Because one,
Stacy would be able to call and,
yeah, and
Get
Judy was
questions
talking
answered.
about, and if there was any educational
Yeah,
topics that a
Yes.
classroom wanted or a
Right.
teacher wanted, that would be part of, they would go
Sure.
in and do a half-hour thing or a
Well, that'd be a
15
good thing,
minute.
yeah.
And
So that would be
But public
something
health
that
already,
could.
they already do that with the, I mean, they come in and give talks
Mhm.
already. So I'm
and
I'm
I
having a
don't,
hard
I don't
time
think
with
they,
this.
I don't think they do. I
They
mean,
do
not,
at the student fair.
No,
I
they
know,
do
but-
for
They do.
the, what age were you when? I was sixth grade.
Sixth
The
grade,
Sixth grade,
yeah.
talk with the boys and the girls and,
yeah,
I don't know what
Yeah.
else, you know, I can't
Yeah.
remember.
And I think we're really focused on that their job's gonna be to have preteens, teenagers talk about sex or talk about birth control, whatever. I mean, I'm thinking back, school nurses were always around and they took your temperature and when you were a little
Yes.
kid and said, how are you feeling? I was at the school yesterday, it was a little boy. I thought, my God, this kid's got whooping cough. He looked terrible.
right.
He's coughing, and the principal was the person tending to him and said,
Mhm.
just
Mhm.
rest, and the parent had brought some cough syrup earlier today. I would guess that that's what I would see as a nurse doing,
Right.
is
Well,
taking
that
on
would
those
see as
kind
Yeah,
Yes.
of
absolutely.
child.
Yeah,
But that's not what this says.
And
I-
that's not the only thing it says,
Right.
that's for sure.
I am uneasy about the ESD going in this direction. This, to me, does not seem like an educational, this is a social service. This is something that is,
right.
I would rather use that money for any number of the things we saw in that survey. Or if you could narrow the scope a little bit. I'm not doubting that the superintendents say they need this.
Mhm.
They actually need a full-time, to do this, you need a full-time nurse in every school.
Oh,
I mean, they're,
I'm not doubting that, yes.
yeah, so
This is-
once a month at best is when that nurse is gonna be at each building.
Right,
So that's a drop in the bucket for this list right here. They're going to have to go to public health for most of this. And if they won't talk to anybody else but the school nurse, that's putting that school nurse into a position that I don't think we have any business being in as a sponsor of that program. Doesn't mean I don't wanna help them, the kids. It's not, I don't wanna say that there doesn't exist a problem. I just don't know that it's an educational service district. Now, if there was a special education person that was trained, if it was more of a counselor, that's what they're trained to do.
right.
So if that's what they want, that makes a little more sense to me. But a nurse, with this, and the other thing I would mention is, because the age of consent is so young now,
You can't consent to be sexually active in Oregon, it's 18, you're not considered culpable or able to make
Right.
that decision, but, so.
But
so
at
it's-
14, what can you go and say, I don't want my parents to know, and you can't tell them, correct?
Yeah,
So you've got half of the high school
it's very,
putting that nurse in a position that she knows something that,
well, that's the law, so it's,
That's-
the law
yeah,
will
I mean,
cover
that's-
whatever the direction is. I
Right.
guess the thing,
it's just the ESD in that position as the funder
that's the part a
versus
little bit.
public health.
I don't
Or
know.
the hospital. If the hospital wants to do it, I think, but that's their role in
What are
this
we-
community, not,
In your
Yeah.
past experience, have you had a nurse in a school setting and?
Oh, yeah,
and-
in school
and-
settings, yeah.
I
And-
grew up with a nurse
Yeah.
at school.
I mean,
Yeah.
we were saying, or I was saying, I remember the nurse in grade school saying, let me take your temperature.
Right.
And lay down and rest. Right
Yeah.
now, it's the school secretary or the
Mhm.
principal or
Yeah,
something.
many of
that
the,
does
I
and
was
that.
thinking it used to
many
be
schools.
A nurse in full-time in
Yeah.
every school.
Right.
You went to the
Yeah.
school, you went to the
Then
nurse
we
and they put a Band-Aid in there.
Everybody, yeah.
Used to be
Give
the
you an aspirin
schools, they would buy their own nurse. I
Right,
mean, it wasn't through the ESD, it wasn't through the hospital or anything else. They would hire an RN,
right.
and they were part of the school district staff.
Exactly.
And they were underneath the same health, for schools, it's FERPA, for health, it's, what's the,
HIPAA.
right, HIPAA, thank you. They were underneath the same HIPAA rules because they weren't RN,
Sure,
but
Sure.
they were actually employed by,
Confidentiality is
they're
the
employed
same.
by school districts.
yeah,
So-
interesting.
Yeah, I understand where your concerns are. You know, as I said, this is kind of a pilot,
Yeah.
you know, and just kind of getting our foot in the door and see where it goes and how it develops. We got this contract from Doofer. Doofer has been doing this for, I guess, a good number of years. And we found that this was the best contract that we saw as far as
Who is Doofer?
Doofer School District.
Oh,
Is up in the
okay.
town of Doofer, up by the Columbia River. It's
Okay,
right, you got,
so they have a nurse that goes
Mhm.
one day a week to different.
yeah. Well, no, they have one, theirs is more kind of on call. And so, but that's what they do, up there. And I think this person would more kind of be on call also. I mean, we're not gonna say every Monday you're going to have to be at this, this place, because there may not be a need on Monday. But we may need you to come Wednesday because our health class would like you to come in and talk about, scabies or whatever, you know. Bed bugs, exactly.
and I do
We're
think-
freaking out about that, so, yeah.
Again, public health could do that stuff, that's planned, that's, arranged.
Right.
You could even pay them out of this 14,000 if you wanted to do that as a extra
Yeah.
program or something.
Well, I think they're looking at,
I guess if they're
Yeah.
on call, then that really does make this even more,
I'm thinking, why would you
nebulous.
call a nurse? Why would you call a parent and say, hey, this is the complaint, go to the walk-in clinic? You know,
as far as what, you mean if,
Like, why would you call a nurse? That if we think this child has a fever, we think they've got a positive TB,
well, I don't know what a positive TB would look like, and I don't know
well,
what,
PPD, it,
right,
a time test and it puffs up and it gets red and,
yeah, I don't,
yeah. I mean, I'm
So-
just wondering, why
so-
call a nurse, why not call a
Well,
parent?
what was the
So what am I
superintendent's?
missing?
It's, no, well, that's why I'm asking him to
Yeah.
handle.
well, I think there's just,
think
I think
that's
there's just a
what they-
lot of questions, and
Yeah.
there's a lot of concerns around kids and what kids are going through and what they need, that school districts, we don't have the expertise to be able to provide. And that's what they're looking for. They're looking for somebody who they can rely on that has the expertise to be able to give them advice or give them information. Somebody who can look up the information on something that may come up that they would be able to rely on. So
I guess,
it's,
So my question to you two ladies, so you're not opposed to the nurse if that's what the superintendents want, but you're opposed to ESDs putting the money towards it. So in our 2019-2020 20 budget, if the schools kicked the 14,000 for that and then we paid the 14,000 for more early special ed, would that be, is that what you're, because you said you don't think this is what ESD dollars should be used for, even though, I mean, ESD dollars is used for what the superintendents say
Yeah.
they need at their school, so in that part it is. But is that that you feel our money should be going to special ed, because that's an important piece, and you'd rather see the 14,000 go towards more special ed, so
Yeah.
that's my question, since it's coming up budget time, right?
Well, and it seems, so with you saying on call, so what, it was 1 day a week, now it's kinda on call.
I guess it would be the equivalent of 1 day a week.
Okay,
So, I mean, you know, because not everything's gonna happen on Monday.
exactly.
Right.
So
So,
that's what I'm
I-
wondering about, even the effectiveness of the whole thing. Okay, just a second, let's go call the nurse and you can ask her that question.
Right.
That's what the teacher's gonna do, so the kid's gonna sit there until the nurse gets there?
Yeah, I don't know, as I said, we've never,
Clayton, were you
we've never
trying
done
to
this.
talk? I heard you.
Yeah, can I just throw this out there? This is my kind of thought on it. Is I kind of agree that I don't know if it's an issue for the ESD. I kind of think it's the funding part of it. But I guess in my thoughts, I'm willing to wait till the budget meeting and throw it at the budget committee and see how they feel about, you know, this way, you know, spending this money like this. Because I kind of agree with Stephanie that I think it's out of our realm. But I'm willing to, if the budget committee was willing to say, yeah, I think that's worth spending the money there, I would be willing to go that route.
I'd like to, I think, hear from somebody who's actually done this, and what does it look like in reality as compared to speculating what it might look like?
Yeah.
And if it's worked in
well, and
further.
we can wait to the budget committee meeting, because all the superintendents will be there.
That's
And
what I'm
then we
thinking,
can hear from them.
Right. And
Yeah.
you'll
I mean, that would be
Yeah.
really
So
helpful.
we can
Yeah.
definitely table this and
Yeah.
bring it back to them
Okay,
And they're,
next week, because we meet on the 21st, so,
yeah, and they're
Oh,
all
sure,
there,
perfect.
and they
Yeah.
can explain
Okay,
why they're
that
asking for
is
this.
perfect.
yeah.
Yeah, why they're
Okay.
asking for this, and
Right.
then what does the budget committee feel?
Okay.
Yeah.
Good solution, Clayton, thank you.
Thank you, Clayton.
Yes.
You get a 4.
I don't know if it's
That was excellent. And thank you.
Oh, yeah,
Yeah, thank you.
nope,
Yeah,
that's.
yeah, thank you.
Yeah, if I
Appreciate it.
can't give you a good enough explanation, let's let them do it, they're the ones asking. so.
Yeah,
Well, and I
Yeah.
felt badly if you discussed it in full last meeting and I missed it, so I
got
Yeah, I had a much better explanation last month, yeah.
Yeah,
But I
well,
was in
none of the
here.
paper, it wasn't together, the
No.
agreement or
Yeah, it
anything,
was,
they were saying
last
that's
month
coming.
was, yeah,
Okay.
last month
Yeah.
was, FYI, I'm gonna be bringing this to you next
Oh,
month.
did
you
Yeah.
started talking about this
Oh,
several
okay.
months ago, didn't you?
Huh?
It came up several months ago.
Well, yeah, but we didn't know, we didn't
Just
meet
kinda-
last month.
Yeah.
I do remember
I don't
Superintendent
have any
too.
recollection of talking about this before, but
Yeah.
that's probably more about me than it is the process.
Okay.
Okay,
So table
Yeah.
nursing services, so,
yep.
okay?
5.3, audit services.
Okay, sorry, I did leave. Okay, so we have the audit services, we had the 2 bids. And we asked them to, because the one company was hesitant about bidding on all of the different districts. And so we asked them, the one company was too high, and we said, okay, come back and give us the pieces what you would do for each one. What's Plush gonna cost us? What's the ESD gonna cost us? So we had them break it down into every single entity. So in doing that, we looked at, they had different prices for the different entities. And so we took this company's lowest on this one, and this company's lowest on this one, and we looked at the 2 of them, we brought them together, and it came out to be $64,500 and some odd dollars. And so it's still 1.5 of what we were paying, because we were 40,000
Yeah.
plus. And so we went back to them and said, okay, we can piece this apart, which we're willing to do, and have each one of you do your lowest price of whatever you bid for us. Or we would like to offer it out there, would you be willing to do everything for $65,000? And both of them came back and said, yes, we would be willing to do that. So we have 2 bids, $65,000 for both of them, and both of them have agreed that they would be willing to do it. And Sarah is getting consensus from the business managers on which company they want to go with. There's one that's called Solutions, they're out of John Day. That's my preference. Looking at the agencies that they work for, they have a whole bunch of small school districts, a whole bunch of ESDs, and that's where I think we should be. The other one is out of Roseburg, and they, what's the name? Essentials? Something like that. Anyway, they're out of Roseburg, and they have a few small schools. They have like Willamina over in the valley. They have, I think, Jefferson in the valley. Most of all of their work is over in the valley. Most of their work is, looks like a lot of state agency kind of stuff, not so much school districts.
And do you think
So-
being in John Day, they have a better understanding of the rural?
That's exactly what is in their proposal, is they
Yeah.
describe that. We are an Eastern Oregon, rural community. We are from a rural community. We work with rural communities, and we
Okay.
understand
That would be
the nature of the
important.
beast, basically, is what they
Yeah,
said.
that's-
So that was part of
that's
their pitch,
Uh-huh.
in their statement. So
And
what,
and who
What
they
is their name?
serve reflects that?
it's called, Solutions, they're out of John Day.
And the entities that they work with reflects that rural focus or
Yes.
on rural. Located.
Is Sarah's door open? Would you, on the right-hand side of her office, as you walk in, there's a little file cabinet, a short one. Okay, the two proposals are sitting on top of that file cabinet. Would you grab those, and then we can look and see who those people are, so you can see. But basically, what we're looking for is approval from you folks to spend $65,000
Sure.
to purchase audit services for the county. And so.
What?
and-
Yeah, well, she gotta
so-
explain.
And we don't have a choice.
We don't have,
And
yeah,
it could- and it
it's one or the other, and that's it.
Yeah,
It'd
at
be
least we
lower.
got two,
No.
we didn't have to
Yeah,
go.
Well,
yeah.
I take it back.
5.
Yeah,
That's the initial proposal, is $65,000. If, once they do it for a year, then we'll entertain that conversation with them. Say,
Okay.
okay, you've done this, you see who we are, you see what we
Yeah.
did,
Can
what,
we go lower?
well, how we presented,
But it's gonna be
no
65
issues, but
year.
this year it's gonna be
Okay.
65.
And as a new,
That's-
it will take them longer.
Yeah,
Because we're all
Since it's
new, they
new,
don't
yeah.
know.
Sure.
So
Yeah.
it's not necessarily a gap,
Yeah.
I'm delighted
Yeah.
though that the things that are important to us were selling points for them.
yeah,
That's
Yeah.
kinda
yeah.
nice.
Well, I was just excited that we got them down $20,000 from the
No
original
kidding.
bid.
Yeah,
We were,
that's
I think
good.
it was like 87, I think, was when we added it all up.
wow.
Her door's locked, my key doesn't work.
Oh,
It's
no,
okay.
mine doesn't.
Yeah.
Yeah, and that's, I mean,
Okay,
for the
so-
65,000, like you
Right.
said, that's the
It's,
issue. not
the
who
issue is
does it.
65,000, yeah, and I've given my opinion to Sarah and stuff, and so,
I
but she's
have
working
complete
with the business
confidence
managers,
she'll-
and
She'll know.
Yeah,
Now, do we have to
so,
approve one or the other, or just to spend the
Just
money?
just
spend
approve
the
the
money.
$65,000 for auditing services.
I make a
So,
motion.
Second.
okay, I have a motion and a second, any further discussion? All in favor? Oh, did you have a question? Oh, okay. Okay. Car purchase.
I move that we approve the purchase of the Subaru from Wilsonville Subaru Forester. How specific do you want it to be on
That's
there?
it. Yeah.
It's that amount, it's,
I can record the VIN or something.
no, it's,
Oh,
23,
yellow.
23, 6 something.
Yeah.
$23,811
Yeah.
from Wilson.
yeah, it's on the yellow page.
Is that, none, you don't have licensing and stuff on top of that? was
Nope,
it?
nope,
That's with the licensing,
that's supposed to be everything.
out the door?
Yep.
I'm going off your memo here.
Okay, I have a motion to
23,000.
accept,
I'll second that.
okay, I have a motion and second to accept the purchase of the new car.
I think the next time I wanna buy a car, I need jacked.
Yeah,
no
Forester.
kidding.
Any further discussion? All in favor?
Aye.
Aye. Opposed? None? Okay. 9:28,
That was a
adjourn the
marathon.
meeting.
Thank you.
Woo!
I think that's a record.
Oh, yeah.
Yeah,
I haven't
sorry.
been this long in